So good afternoon. I'm going to start the I think this is the second video, right? After I talk about a brief talk about the why thing. So this is going to be the fundamental on what after why, and then I ask myself of what. And this is going to be the first fundamental chapter. So this chapter 1 is a fundamental one, something that we need to know before we embark on this science itself, science or the knowledge itself. Before going to this bread and butter or the meat, I ask myself, I question myself, and I try to contemplate what. Okay, what can I do? What can I do with this? Because if I know what can I do, I'll be able to categorize, or maybe I'll be able to categorize things into its part or into its sections. So you know that maybe this is a common question, or it's just an easy question, that if we ask someone, or maybe we ask people, random people, or maybe ask a kid, and then we ask this question: do you know what can a doctor do? Or what is the job of a doctor? I bet that this is the first or the most common answer that will come up. They'll say that the doctor cure patient. So even the past, even me in the past only know this: cure patients. So get a doctor, cure patients, or help people. Maybe that's the thing that come up in my mind. But now I know that actually it's not the only thing that a doctor can do, or not the only thing that we can do if we learn medicines. So let's make it simple. If you're talking about curing patients or curing people from their illnesses, this is the state, right, where is sick, right? People is sick. This is the state where they need help or cure, right? But before sick, and this is the majority of the condition that people are in, is health, right? Is in a health, in a fully functional bodily or organs before it comes to sick. And after you got sick, we see that some people are in maybe less than, so it can give two outcome: less than before the fitness, right? Their fitness, this is fitness, less than before sick condition, or maybe can back to normal, or the first state in this term is health again, right? Fully functional 100%, and this is maybe like less than 100% of bodily functions. So this is the sphere. These are the sphere that a physician can contribute toward the patients or society. When they're still in a health condition, this condition, we can do a promotion, health promotion, which means to maintain this condition so it's not fall into sickness, or prevention. So yeah, we can do something to prevent from being sick, so that someone can always in a good health and they can function 100% all the time. And at this stage, we can do a curative, okay, curing, fixing broken thing, fixing a non-functional thing, so that it can either this or this. So this is of course the thing that we want, that after doing a curative or fixing process, that they can, the people or the patients can regain their health 100% as before. But at some point, this is impossible, because it occur very deep, or the sickness was very in a stage that is very difficult or impossible to regain 100% of their functional. So it's kind of like less than before or less than 100%. And in this sphere, a physician can do a kind of a rehabilitation to try to recover the functions back to 100%. But if it's impossible, maybe close to the way before. But at some extent or some point, we cannot go back to 100%. That's something that we have to accept it, and we have to know that we are not a superpower or not powerful enough that we can fix everything. That's impossible. But we try. The point is, we try to return things back to normal. So if I ask myself, what can I do? So I can always do these things, a health promotion or preventions for someone not to fall into sickness, and then curative, or try to fix it and try to rehab, or to recover the functions. So which one is the most important thing? In my opinions, but well, people can differ in their opinion. Actually, this part is the most important part. In my opinion, yeah, the most important is to prevent or to promote someone's health, so that they do not fall into sickness. And then the next one is, rehabilitation and curative are all important, but this one is actually the most important and the cheapest and the most important. But many physicians forgot this one. It's kind of like they kind of forgot the importance of this step. They only, well, I do not want to say that, maybe me at that time, I do not know that one. Many people forgot this one, the importance of the promotion and preventions, and instead of that, the only thing that this is the core, but actually it's not, in my opinion, but people can differ in opinion. So that is the what that I want to say, and the fundamental thing that we have to, that I have to keep in my mind that this is actually the most important thing, is to promote health and to prevent from someone from falling into sickness or illnesses. Thank you.